All right, welcome back to another episode of Innovators of Health, here with my co-host, Dr. Rahul Desai. And today we have Dr. Ashu Goyle from the Integrated Spine, Pain, and Wellness Clinic in Scottsdale, Arizona. Ashu, thank you so much for being with us.
Gentlemen, thank you for having me. It's a pleasure.
Well, I'm going to jump right in. You trained at the Cleveland Clinic. You became a double board certified and went to found, ISPW in Scottsdale. What inspired you to go beyond traditional pain medicine and start building a practice that's focused in whole person wellness?
Great. So let's go back to the very beginning. My passion in high school when I was younger was music. And that's really what drove me. That's what motivated me. I started playing guitar. I was self taught, got into some bands and wrote songs and really just pursued the arts, if you will. And I found this, not to get too cliche, but there's a healing power of music, right? There's a vibration, there's a frequency there. And it really struck a chord in me. I felt like music has the ability to bring people together and it has the ability to make people just feel good. At least that's what it did for me. And so I was going to a lot of concerts, experiencing music from bands, the music coming towards me, and then also playing music and the music coming out of me. And the collective union of that energy and that vibration really motivated me to want to give back to the world, right? And find something where I was actually contributing. So went to college, was very undecided, but always had this holistic view of the body, how it works, and I was very interested in Eastern medicine. Not really interested in pursuing Eastern medicine, but for myself, I was really into supplementation. We're talking early '90s, so this is I was in college in 1992. That was my freshman year of college. So before vitamins and supplements and nutraceuticals were a trend, I started exploring those already. And I was always into fitness, working out, taking care of myself. Got into yoga my freshman year of college, hatha yoga, and this is before there was Lululemon. No such thing as like these yoga studios that are everywhere now. No rock and roll music or rap music playing in the yoga studios when you're doing yoga. It was true hatha yoga, focused on breath work, movement, alignment, and so I'd always had this innate curiosity and belief that the body had its own ability to heal itself, right? And it's what I like to call now cellular intelligence. So, to make a long story short, I got into medicine in a kind of a convoluted path and went to osteopathic medical school because I felt it aligned more with my philosophy of whole body healing, right? I felt like it was a nice bridge between the traditional Western medicine world, but it also had this view of the body being able to heal itself through structure and function. And so I really wanted to blend the two together. So I went to DO school. My third and fourth years of medical school rotations were through the Cleveland Clinic. I'm from Ohio, so I went to Ohio University, and for our third and fourth years, a group of us got to go to Cleveland, and we rotated through the Cleveland Clinic healthcare system. While there, I discovered pain management. And that's really where my passion was. I found a field of medicine where I felt we could do these interventions and we could restore people's quality of lives, right? And that was profound for me because I felt so much of medicine was just managing blood pressure, managing diabetes with pills, and there's definitely a place for that, but it didn't resonate with me. I didn't see people teaching lifestyle medicine and ways of preventing the need for these medications. But with pain management, I found a field of medicine where, we have the option, we have the opportunity to not only treat pain but also offer solutions for prevention. So I pursued my career in pain medicine, did anesthesia residency at Cleveland Clinic, and then interventional pain management fellowship at Cleveland Clinic. And this was a hardcore, heavy interventional based practice focused on modern medicine and pushing the boundaries of modern medicine, right? So we did a lot of epidural steroid, corticosteroid injections, radiofrequency ablation procedures, intrathecal pumps, spinal cord stimulators. And at the time, we were taught that this is root cause medicine. We're getting to the root cause, which is this herniated disc that's pressing on a nerve and causing pain. And we're going to put steroids there, which are going to shut that whole system off. And then we've treated the root cause. And so I subscribe to that paradigm. And I still believe there's a place for that. So I finished my fellowship in 2007. did a year of private practice in Columbus, Ohio from 2007 to 2008, practicing traditional pain management. 2008, I moved to sunny Arizona after not seeing the sun from April to May in Columbus. It's like I have to get out of Ohio. So moved to Phoenix, Arizona, and I worked for a large anesthesia and pain group. And my focus there was traditional pain management, multiple injections, medication management. We did have a somewhat holistic, we had a multimodality approach. I won't call it holistic, it was multimodality because we were incorporating physical therapy. I was networked with extraordinary chiropractors as well, so there's some body work, physical structural alignment. But after 10 years, so in 2017, I was starting to get burnout. And I was seeing that I was taking patients so far. I was doing injections, they'd get better for a few months at a time, and I could carry them for a certain amount of years. So let's say from 2008 to 2012, I was able to manage their back pain or whatever spine pain they were having, but we'd follow up with MRIs 4 years later, and their spine had actually gotten worse. More degeneration, more deterioration. Well, fast forward to 2017, after treating thousands and thousands of people, I went to a conference, pain conference in Napa, and the pre-conference symposium was a day dedicated to regenerative medicine, which at the time I knew nothing about, but I was very intrigued. So I spent the day going to this symposium, and I learned about the body's innate intelligence and its ability to heal itself, and it took me right back to my roots, well, almost 25 years ago, right? When I first started discovering the body's innate ability to heal itself. I'm like, oh my gosh, this is what I've been looking for. So 10 years into private practice, starting to face burnout, pretty intense burnout, and I found something that reignited that passion and that spark for medicine again. And I was like, oh my gosh, we learned about Kobe going to Germany to get this special sauce, put it in his knee, put it in his ankle. And I'd heard about it in 2010, 2011, but now in 2017, I knew what it was. This interleukin 1 receptor antagonist protein, this growth factor that's derived from blood, PRP, bone marrow. And my mind was blown. I'm like, here it is. We have it, and people are doing this. And I didn't know anything about it at that time. So from 2017 on, I started pursuing what I call a mini fellowship in orthobiologics or regenerative medicine. I went to courses. I connected with some of the experts in the field. Took ultrasound courses, and I took a deep dive into the science behind what this field really is. And it really reignited my holistic view of medicine and treating the whole person again. At the time, I was in a corporate medicine practice. I wanted to bring these therapies into that practice, but the corporate entity that was running us didn't believe in that type of medicine. Self-pay, number one, not covered by insurance. Number two, there's more overhead involved. So they were like, hey, look, that's great that you're doing that, but we're just going to have you stick to what we know and what's working for people. Okay, great. So then I started plotting my escape. So 4 years later, 2021, I left corporate medicine and I started my own practice, Integrated Spine Pain and Wellness. And it had a heavy focus on holistic approach to helping people actually heal their pain, not just mask their pain. And we started doing this through anti-inflammatory diet and what I call an anti-inflammatory lifestyle, minimizing environmental toxins, focusing on sleep hygiene, movement, meditation, mindset. And for the first couple of years of this practice, or from 2021 to 2023, we were still heavily insurance based, right? Mm-hmm. And so I was seeing a lot of people who were not necessarily subscribing to this. And they're like, hey, look, I just want to get my epidural shot and get back to my golf life and drinking and eating bad food because the shots work. I get 3 months of relief, right? So over those couple of years, my practice started to evolve, and I just wasn't resonating with that kind of medicine, right? I really wanted to see people who would invest in their outcomes, invest in their health, and go on a journey with me. Because I feel like with regenerative medicine, these aren't quick fixes. As you guys know, it can take 3 to 6 months before you notice any improvement whatsoever. Sometimes 6 months to a year before there's that profound improvement and life-changing event that happens, and people realize, wow, my back pain isn't limiting any of my function anymore, and I can live the quality of life I want to live. So I started building the practice around people who want to go on this journey with me. And over the next couple of years, we started weaning off of insurance, right? Because insurance, unfortunately, doesn't allow us to care for people the way that at least I want to care for people, right? Spending time with them, connecting with them, really listening to them. So weaning off insurance it's been a process. We're actually almost done with insurance. We'll be done with Medicare at the end of the year, so we'll be 100% self-pay concierge, which allows me to really focus on a holistic approach to helping people get better through all the things I mentioned: mindset, movement, meditation, diet, lifestyle, and then through these orthobiologics that we do. Photobiomodulation, big fan of light therapy, hyperbaric oxygen therapy, all of these things, right, that can have profound positive changes in the body. And ideally, it's about prevention, right? I mean, I'll be 51 in a couple of weeks, and my goal is to be better, or at least as good as I am now at 80 or 90, right?
Hmm.
And I think it's possible. I really do. I think with the tools we have available to us, we can do that now. I like to share this story of a client of mine who came to me in 2021 when I first opened the practice. 87-year-old gentleman, was a former CEO of a Fortune 500 company, very successful, in great shape, super sharp. But at 87, he's like, look, he's like, I'm still running multi-million dollar businesses. He's like, it's what I do to keep my mind sharp. He's like, the moment I stop, I'll get Alzheimer's and turn into an old man, right? So he's like, I got my mind going. He's like, I'm married to a woman who's 25 years younger than me, and she's fantastic. We have a great relationship. He's like, my body's in good shape, but it's not in great shape. He's like, I got knee pain, I got hip pain, I got shoulder pain, I got neck pain, and I got back pain. He's like, I want to be better at 90 than I am at 87, Goyle. What can you do? And so we put him on a plan, anti-inflammatory lifestyle, right? Like we cleaned up his environment. He started limiting the amount of alcohol he was consuming, got him on a hyperbaric protocol, got him into photobiomodulation. We did a combination of PRP, bone marrow aspirate concentrate in his knees, his hips, his low back, his shoulders, and his neck. This is of course, over the course of 3 years. And at 90, we got him better than he was at 87. He showed up at 90. He's like, Goyle, he's like, I'm better at 90 than I was at 87. And he gave me some examples of his life that had shifted in a very, very positive direction. We have, if you're familiar with Scottsdale, Arizona, there's a famous mountain here, Camelback Mountain.
Hmm.
And Canyon is a very, very challenging trail. I mean, a hike, it'd be hard for me to do right now, and I'm in pretty good shape. But we got him going. He said at 90, he's like, I'm able to go up and down Camelback twice. So up and down, up and down. He was doing that 3 times a week. By the time he turned 91, he was back to benching 200 pounds again. And like in 91, he can bench 200 pounds. And he's like, Goyle, I'm good. I'll come back when I need you. He's like, I got everything dialed in. But anyway, so that's what my practice is built on now. So it really, long way to answer your question, but really that's how I got into it. It all started with music, and then it
Yeah.
evolved to yoga, and then it got even clearer through osteopathic medical school, Cleveland Clinic anesthesia residency, and fellowship took that away from me for a while. And then I rediscovered it in 2017. And so I feel like, with medicine, with life, we're constantly evolving and reinventing ourselves. And yeah, so
That's thank you for that. I mean, Nikola Tesla said we're all, everything's made up of energy, frequency, and vibration, right?
yeah.
And you started with the music and the vibrations of music and led you to this point. And we're all made up of light. And so here today, so we're talking about light as medicine. So let's talk about what was the doorway that led you to, light as therapy and red vibe and integrating red vibe and red light therapy into your practice.
Great. So, okay, I got a little bit of story about that too. But, I grew up in southeastern Ohio. My backyard was Wayne National Forest, foothills of the Appalachians. So I grew up outside all the time.
Hmm.
I enjoyed the outdoors. I always have. Right. So I've always believed in the power of light, not necessarily with an awareness, but just more of an innate, knowingness that light is really incredibly important for us. But in my later years, I would say when I really started paying attention to light again was Andrew Huberman.
Hmm.
He talked a lot about light exposure, getting outside, 15 minutes of sunlight every day, staring at the sun for a few minutes, right? So when I started listening to him, this was around the pandemic time, right? So 2020, 2021, it really sparked my interest in light therapy. Actually, I'll back up. Let's go back to Ohio and Cleveland, especially. you guys know Cleveland. It's Midwest. It's cold, gray, gloomy, ugly from November to usually about April or May.
What a great
Uh,
description.
it really is. I mean, listen, I love Ohio. I mean, it's my roots. My favorite people are from Ohio, but really, it's just cold, gray, ugly, and gloomy, and it's just depressing. And so, I actually had one of those light panels for SAD, for seasonal affective disorder, because
Hmm.
I would suffer from that, and I'd keep it in the bathroom. So every morning when I would get ready, brush my teeth, whatever, that light's just blasting on me. So I have no idea if those were therapeutic or not, or what kind of light was what kind of light was actually shining on me, if it was all UV light, or if there was actually any full spectrum there. I don't have any idea, but I felt like it did help me. So I started light therapy around then, but I got back into it shortly after the pandemic, um, mostly from Huberman explaining the benefits of light therapy from a more scientific level. And then I started doing these orthobiologic therapies, right? And MLS laser, class 4 laser popped up quite a bit. And I learned the power of light therapy through photobiomodulation through MLS laser. And then, as part of my own self care routine, I've been doing hyperbaric oxygen therapy. But the practice which I go to, they also have a photobiomodulation bed. And so I started incorporating that. And probably in just a few months, I noticed a profound shift, right? I mean, energy levels, sleep, brain fog, and I knew it was a combination of the hyperbaric and the light therapy, right?
Yeah.
So with the orthobiologic world, a lot of my colleagues were incorporating red vibe, red light therapy into their pre and post procedure protocols. So I started exploring that further. And I got connected to Rahul last year at Toby. I believe you were the instructor at my cadaver lab, and you and I connected there. And they had the MLS set up, and so that was going on. And then we started having a little bit of a discussion about light therapy. Then it wasn't a few months later that we really connected on the power of at-home class 2 red light therapy and the benefits of microdosing light therapy. And so I started doing it myself, and I do it now. I do it religiously every single day as part of my meditation. I put the red vibe in front of me, and I do my 20-minute meditation, or sometimes 30-minute meditation. And I feel like it's the best way to start my day. It resets the circadian rhythm. I mean, Rahul can go into more of the science and physiology of this, but I started incorporating into my routine, and like I said, I'm very religious about this now. And now, with some of my big orthobiologic cases, I actually give my clients a red vibe unit so they can continue light therapy at home post procedure. Um, in my procedure, so I do a lot of bone marrow aspirate concentrate, and for those of you who don't know, that's where we take the bone marrow from the back of the iliac crest or pelvis, and that's a little bit of it's a minimally invasive process, but we're using an 11 gauge to go into the iliac crest. Immediately after I'm done, we stop the bleeding, achieve hemostasis. We have the big Red Vibe 300. We bring that panel in and set it 6 inches above the wound, and just then the entire back is exposed, and we let it run for 20 minutes. And I can tell you this: I've done a lot of these bone marrow procedures. Ever since we've done that, no one has complained about any pain from the aspiration site whatsoever. Not one. It's consistent. And even my staff has noticed that too. They've been like, so how are people doing when we do the red light? I mean, no one's complained about pain there. If
That's really cool.
just an ache. Yeah. So I think there's an acute phase response that happens, even with with the red vibe, that light therapy. It's powerful. It's medical grade. Um, I think it's doing something to just blunt that post procedure pain. So
What a cool use. Yeah, that's the first time I've heard that, but I love it. We gotta to have more folks integrate that. Not only are you getting the analgesic pain relief, but you're stimulating these biologic processes. They're going to feel those
exactly.
benefits kind of long term.
Yep.
Um,
Hmm.
besides that, have you seen any? I mean, obviously your own story is really significant, and do you feel like have you had enough experience with the at home like utilization of the photobiomodulation, and that's where you're using it, and I've used it too in the clinical beds, and the only thing was just the dosing pattern, right? It was pretty intermittent that I was getting that medicine. Now that you have it at home yourself and you've been implementing it with patients, have you noticed any shifts or any cool cases that come to mind?
Oh yeah. So in July I did a big bone marrow spine case, and I gave the gentleman an at home unit as it's just part of the package, part of the program, and he's been using it every day. And he's like, "Look, I know you said it was going to take 3 to 6 months for this stuff, for this bone marrow stuff to work, but he's like, honestly, my hip and back feel amazing." He's like, they already feel better. And he's like, I don't know if it's because he's doing light therapy twice a day. He does 10 minutes twice a day on his back and then on his hip that we treated. And I tell him, I'm like, honestly, I think it's a combination of the light therapy and all the growth factors and all the anti-inflammatory cytokines that I put in all your tissues. So I really think there's something to that. I mean, I know you, Rahul, you actually use the red light to activate the PRP before you inject it. And I know Dr. Joe Parita has an actual device that he's invented that does that as well. I'm not sure of all the technology that he uses or he has, but that's something I haven't done yet. I just got a nice big, like, medical grade laminar flow hood, and yeah, so I'm gonna put a unit inside there because it I can actually has an outlet.
Yeah. Oh, okay. Yeah.
Yeah, so I can plug it in under the hood, and after I'm done processing, give the PRP or even the bone marrow aspirate concentrate 10 minutes, and activate it, and then put it in, inject it.
Yeah. You can even do probably with our, when we can talk about it,
Yeah.
but even shorter times, probably 90 seconds.
Oh, really?
At
Okay.
close, yeah, it's a pretty powerful uh, dose that it's getting. And looking at the studies, um, you don't need a lot, so it's not a big disruption of like workflow. It
Okay.
can be done like pretty quickly.
Yeah.
And it's funny that you mentioned Dr. Parita. We were literally, that's who we were visiting in Florida. So
Oh, right
we got
on.
to see him in his clinic, and he's leveraging light therapy as well. I
Oh,
think
yeah.
he's actually gonna put a few Red Vibe units. Both he has one at home now, and
Oh,
he's been
cool.
using it and gonna deploy some for his clinical applications. And so it's been pretty awesome to see uh, the excitement. And I think it's obvious because patients are feeling so much better. There's less pain. There's faster results. It's just turbocharging your cells, and then you're applying the cells into all of those tissues, and it's been pretty amazing as far as like the systemic responses that we're seeing. And
It's
I
amazing.
also believe that the beautiful thing of it, like you said, is we are changing. You're developing such strong relationship with these patients, like the way that you're doing this medicine. It's I feel like medicine is interesting because not only are we seeing that with like our clients that we're you were as a Red Vibe as a company, our clients that we're working with in clinics and physicians, they want to have a relationship, long-term relationship with their client, with their patients, and that's what we're seeing as Red Vibe because that's our mission too.
Yeah.
Like we are developing long-term relationships with our clients, our providers. Not we're not It's not transactional, and I feel like a lot of medicine has become transactional. You get 15 minutes with your doc, get all your stories out there. Here's some medications. We'll see you in 6 months.
That's
Here's the
exactly
labs,
right.
and it's such a transactional relationship,
Mhm.
and you're not getting good medicine. And then I feel it's coming from that. So that when you mention music, like J. Dave and I, one, we're from Ohio,
Yeah.
and we did not plan the coordination of the shirts today. It was pretty close. And but we're both who grew up around music
Yeah.
really deeply. We talked about that, I think, even before.
Hmm.
And so it's interesting to me. It is very vibrational and almost finding your tribe, right? That
Right.
there is this group in medicine that's expanding and growing. I spoke to a group of podiatrists, and they're all feeling that same thing, and it doesn't matter what field of medicine that you're in, they're seeing a deficit, and they have a deep desire to see outcomes improve, and they realize it does take kind of a holistic approach. And so it's really cool that they're, diving into this and really finding, um, how do you apply regenerative medicine and the scope that it portrays. So yeah, I mean, kudos to you with what you're doing. We love to see it, and that you and your family's on board is fun too.
Oh yeah, I mean, and I've learned so much from you, Rahul. I mean, just since I've started exploring Red Vibe. I mean, your generosity with your knowledge has been tremendous. It's changed the way I practice. It's enhanced the way I practice, and it's been the best thing for my clients. It really has. All my clients who have a Red Vibe unit absolutely love it, and they use them. They use them all the time. You know, they're like some of them like have the smaller units. They travel with them, and I'm gonna try to. I'm actually. I don't know if are you gonna be in Vegas this week for Toby?
I'm not gonna make
Oh,
it. There's
conference.
Are
too
you going
much
to be
travel.
there?
I'm gonna be there. Yeah, I'll fly out tomorrow, and I'm gonna try to see if I can squeeze my red body into my suitcase so I can
There will be
continue.
there'll be a unit there. Accelerated
Okay.
Biologics. I think they're going to have a panel
A
there.
booth.
A booth.
Okay. Cool. Yeah. Well, it's kind of
Fancy
different.
that.
Yeah. Yeah. Because I like to do it without clothes on
I
in front
know.
of the. Yeah, you
Yeah.
know what I mean. Really bathe in
Yeah.
that light.
You,
So
you don't want to do what you're doing.
I'm not doing that video.
You're not
Yeah.
doing
I'm a pretty confident dude, but I'm not an expert. Yeah. Those things are better
It
left in
is, it
privacy
is,
of
it
my
is
room.
Vegas, you probably wouldn't.
Oh
no,
my goodness. Yeah.
no. It
Well, how
is.
do you see this progressing? You're in the forefront of this sort of medicine. How do you see, like, I know you don't have a crystal ball, but where do you envision your practice, and even, what's your vision of your practice in say like the next 3 to 5 years?
Yeah, that's a great question because my vision is constantly evolving and changing. A lot of it has to do with what's presented to me. Like I didn't know I was going to be incorporating light therapy into my practice to the level that it has become. Right? That's a relatively new development over the last year and a half. But especially over the last 6 months. Now I'm giving units to my clients who are doing these bigger cases with me. It's part of their healing package. Um, I can see us in the future having a dedicated Red Vive room, right? So people who like, hey, look, I don't want to. I just want to pop in when I see you, and I'll just go do my 15 minutes in your room, and then I can head out. I can see us having something like that for clients. Um, there's all these what Perspire is that one of the infrared sauna studios that's out there. I can see that our clinic having something like that with Red Vibe, though. With these red light therapy panels, I think it just makes life easier for people to just pop in, take their clothes off, 15 minutes in Goyle's office, and then head out. Right? I can see even pre and post procedure. Like now that I'm incorporating the 300 post bone marrow aspirate, so what we've started doing for people who are going to be going from face down to face up, so prone to supine, uh, my team, while I'm processing the bone marrow, they'll have the person turn over and they'll use the red vibe on whatever body part we're treating. So they'll get another 20 minutes kind of pre-procedure on the body we're treating. So I can see that becoming a part of the protocol consistently, where it's not quite yet. Um, I'm excited to see where the research goes. I know Parita has done a ton of research with light therapy, but I really think the more science we can get out there, the more widely accepted this will be. To me, it's common sense. I mean, like Jay was saying earlier, it's like we're beings of light, right? Without light, we're gonna die. Like we need light, and this light has these biochemical and physiological reactions in our body that keep us alive and keep us healthy, help tissues regenerate, help tissues heal. Right? The more we can show that through repeated studies, science, experimentation, I think that the field is going to be more widely accepted, and I think we're going to see light therapy become part of mainstream medicine. I mean, that's the ultimate vision, right?
Yeah.
I'm going to try to do it my way. So hopefully, in 5 years, light therapy is going to be synonymous with integrated spine pain and wellness (ISPW). Oh, they do light therapy there. They do
Yeah.
photobiomodulation there. They do spine pain and wellness, but part of that wellness is the photobiomodulation.
Do
So
you, do you see any other things that you're using? I mean, and I was thinking, even uh, other areas of your practice, maybe not limited to photobiomodulation. Where do you see areas, I know there's a huge interest in like peptides and all kinds of, different things that are kind of moving our healing in the same direction. Are there any other things that you see that are either complementary to like what you're doing? Obviously the photobiomodulation, but where do you see this your field going?
Oh wow, yeah. Well, I think an integral part of orthobiologics and stem cell therapy and growth factor release and cytokine modulation and attenuation is hyperbaric oxygen therapy, right? I don't think enough people are doing that. I've been doing this for the last couple of years. It's part of my protocol. I tell people, look, if you're considering even something as simple as PRP into your CMC joint, like I want you to do 2 to 3 sessions of hyperbaric pre-procedure. I do the procedure. They immediately leave my facility and go to a medical grade hyperbaric oxygen facility for true medical grade hyperbaric, and then they do a few sessions the next couple of days, right? My big spine cases, I like them to do 5 sessions a week of, 5 sessions a week after. But I think like true medical grade hyperbaric is going to be a big part of orthobiologics. I mean, we know from studies that have been done over the last several decades that even one session of hyperbaric oxygen therapy can increase MSC production MSC release from the bone marrow into our circulation 8 to 20%. I mean, that's huge, right? So
Hmm.
if you're doing these procedures, even a PRP procedure, and this is one of the reasons why when I do PRP, I want people to do hyperbaric oxygen therapy because one of the key growth factors in platelet-rich plasma is platelet-derived growth factor BB, right? And this growth factor has the unique ability to serve as a homing signal for MSCs. So if you have MSCs on this side of a petri dish, and then you have platelet-derived growth factor BB on this side, the MSCs migrate to the other side of the dish, and once they get there, they start to replicate and divide. So if I have people doing hyperbaric oxygen therapy 2 to 3 days in a row before I draw their blood for their PRP procedure and perform their procedure, we've got an increase in circulation of MSCs. Then when I do the procedure, these growth factors have a very short half-life, unfortunately. But if I'm concentrating the platelets to a very high degree, putting them in areas of the body that are injured, and then releasing this platelet-derived growth factor BB, those MSCs in circulation are going to be attracted to that area and rapidly supercharge healing. And so that's why immediately after the procedure, they drive down to one of my favorite places in Scottsdale, Arizona, Benesair Health, where they have true medical grade hyperbaric oxygen therapy, and they go directly into the chamber because now they've got platelet-derived growth factor BB saying, "Come here," and then they go into the hyperbaric. MSCs get released into circulation, and they're drawn to that area. So I think that synergistic effect is tremendous, right? And I think hopefully over the next several years, we're going to see more true medical grade hyperbaric oxygen therapy incorporated with orthobiologics along with the photobiomodulation. Shockwave is another the energy medicine. I'm a big fan of that as well. I don't have it in my practice, and that's more of a respect decision because I've got a concierge physical therapist who has a very thriving business based on shockwave therapy. And we have a very great synergistic relationship. He does a shockwave for my clients as well as the physical therapy, personal training, and rehabilitation. And then he'll refer me people who are potentially broken and need orthobiologics. So, yeah.
Very cool. Yeah, I love all of those things. And you're getting up to above 2 atmospheres. Is that when you consider medical grade?
Well, not only that, but a true hard shell chamber without the mask. It's 100% oxygen piped into the chamber, right? So no lotions, no colognes, cotton clothes, no jewelry, no electronics, like true medical grade hyperbaric oxygen therapy. The kind that if you screw up, you could blow up in, right?
Yeah, yeah.
Yeah.
Yeah, 10 years ago, when my mother was in stage 4 of ovarian cancer, I had her in hyperbaric oxygen chambers frequent. And even in the last stages, a week prior to her transcending, she had a lot of distension that would have been created. She would have been in a lot of pain, and I had her taken out of the hospital and literally had a Cole Healing Center in Cincinnati in Westchester, Ohio, stay open specially for her and get her into the hyperbaric oxygen chamber. And I had her in there multiple days, until she transitioned, and that helped her from a pain perspective. It would have been, I mean, what the situation that she was in and getting her into that. I mean, because of HBOT, it really, really helped big time. So I'm a big fan of it, and I've been for 10
Yeah.
years now, seeing the benefits. So it's cool to see that you're, a big proponent of it and seeing how it's working.
Yeah, it's
I, would,
tremendous. And like you said, it can really reduce that swelling and inflammation,
I
right?
mean,
Even
6 pounds of
1%.
oxygen that you're going to get in a fraction of the time. I mean, you're not going to get that much. You're not going to be able to get that much oxygen into your body the way you
Mm-mm.
are when you are in one of those machines.
Exactly. Yeah. And
Yeah.
yeah, I mean, I love it. I'm in the hyperbaric chamber every Saturday. I can go. Like, if you want to find Goyle on a Saturday morning, he's at Venice Air Health in a chamber,
Cool.
2.4 atmospheres, 100% oxygen for 90 minutes. Yeah, that's my self-care Saturday routine. Well, one part of it. Um, but it's been incredibly beneficial for me. But then, like post procedure, though, like with these procedures that we do, there's a lot of edema that happens. Right? It's
Hmm.
painful, and there's a lot of swelling. This hyperbaric can really calm down the post procedural discomfort for those who can
Yep.
do it. Yeah, it can be
Yeah.
really beneficial. So, but it's anywhere. Rahul, I just tell people whatever they can tolerate. Even 1.5 is better than 0.5, right?
Yeah.
So, if they can go to 2.4, that would be ideal. I mean, that's what I do. I'm comfortable at 2.4 at 100% oxygen. I do that for 90 minutes every Saturday. I'm not traveling, and I think that can be very beneficial. So, but anywhere 1.5 to 2.4, but with 100% oxygen, I think that's key. You know.
What do you think about the at home soft chambers? I mean, we had done a deep dive into HBOT, and I kind of fell upon the same thinking that if we were wanting to do that within the clinic, that we looked at a professional hard shell HBOT
Yeah.
chamber as the best, and really looking at trying to get above because they can get the soft chambers you can get at 1.5, 1.7, but
Yeah.
nothing really approached the two safely, or they're just not rated for that.
Exactly.
Um,
Yeah.
but and then we saw that the benefits really came with consistent use as well, and that was one of the challenges we had with our patients is just the repetitiveness and how time consuming it was, and then looking at some of the studies, I remember falling upon that number. I think it was like 40 hours was the kind of the sweet spot,
Mhm.
perioperatively, that it's really making a huge difference. But that was kind of a challenge to do like 40 hours in 30 days.
Yeah.
Um, and but we did. I took my daughter too, Jay. I don't know if you know that. She has chromo. I don't know if you've ever heard of that. So chronic relapsing multifocal osteomyelitis is an autoimmune
Oh
condition,
wow.
and so she's had to have some surgeries on her knees for that. And it's a kind of like JRA that attacks the growth plates, and it can be self-limited to that age. So when they close their physis, a lot of the patients improve. But it had some when she was in her really bad like inflamed throws. I was with her in the chamber. So we go to a big like professional grade chamber with two-person, go
Hmm.
down and lie in there, and she was like 11 or 12 years old, but really helped her get through that like some of her severe pain stages. But yeah,
Yeah.
I think we're all on board with that. But yeah, I mean, pretty awesome that you're leveraging all of these things, and it sounds like you have an amazing community of healers around you.
Oh man, I'm so blessed. Like really, like every time I meet someone new, I'm like, listen, I've been so fortunate to connect with the people I've connected with because they're all practicing medicine on the same level that we are. They've got the same ethical standards, truly connecting with people and really, really investing in the outcome of the client that we cross paths with, right? It's hard to find that in medicine, you
Yeah.
know? And like you were saying earlier, it's very episodic transactional care, 15 minutes is pretty impressive for an insurance-based practice. I mean, when I did the number crunching when I was in insurance based, even in my solo practice, for the first 2 years, we were drowning miserably with insurance. I mean, it was ridiculous because I was running it like a concierge medical practice. I was spending 15 to 20 minutes with every patient, sometimes 30 minutes, sometimes 45. And with an insurance based practice, you cannot do that and survive. Like,
Yeah.
I learned that the hard way. And so, unfortunately, we had to drop insurance and Luckily there's a pain doc on every corner in this town. So if you have insurance, you're going to be fine. And if that's the kind of medicine you want, you really don't need me to do that, right? But
Mm.
yeah, but for these more advanced therapies, it's important to have a network of people. And so I've got, concierge medical physicians who are at the top of their game, world class clients from all over the world coming to see them. They've got true medical grade hyperbaric oxygen therapy, world class physical therapists, personal trainers. We've got Red Vibe now, which is fantastic. Like all my clients are getting exposed to Red Vibe now, and several have bought home units for themselves once they've realized the benefit,
Yeah.
and they're loving their home units. Um, yeah, it's really important to have a network of people that support your vision and that align with your vision, right? We talked about with music, it's vibration, right? We're all on different frequencies, but when you find your tribe, we're all vibrating on the same frequency, right? And it's just
Yeah.
understood. We're going to give the best care to our people that we can because that's what we believe in, right? It's like I see every client of mine, and I know you guys do too. They're an extension of me, right? They're just a reflection of who I am, right? Just a different version. And it's about elevating us all, right? and
Yeah.
and luckily we have these therapies now that can do that, that aren't masking, that aren't destructive. They're regenerative, they're healing, they're supportive, they're preventive,
Yeah.
and I think that's the future of medicine.
Yeah, for your, we're going to get this to your, obviously, spreading this word to your audience and patients, and uh, the effect medicine has had on me, just personally, is it's incredible. Like it's saved my life. I don't know how many surgeries I have avoided and potential complications from those. Um, yeah, I think I've had 18 PRP and stem cell procedures. I have Ehlers, as you know, I have
Yep.
EDS or Ehlers-Danlos, and I'm just really hyperlax, and my tendons and ligaments break down faster than my muscles or bones,
Yeah.
and you know all of my soft tissues from Achilles tendon to spinal discs to I've had I've had intradiscal procedure, and they were game changing, not just clinically, but I have the imaging proof that they are healed. Right? It's
Yeah.
pretty freaking amazing. Um, and I haven't been this excited, since I just been working with regenerative medicine and stem cells with photobiomodulation, especially home. Like that's something that I'm excited about getting that, and that's what it's nice to hear that somebody's using it twice daily. We talked about that kind of that pattern of AM, PM,
Yeah.
and our body, like that cellular intelligence. That's I love that term as well. And the light affects, that same medicine hits us in the morning, hits us in the evening, and our body's smart. It does different things with it,
Yeah.
right? In the morning and night, and it's pretty crazy. And I think we're going to elucidate a lot of things. So, thank you so much for uh, leveraging this for your patients, trusting the medicine, and as things come up like this, please let us know because I'd love to. We have more of these conversations, but just the way that you're applying that, and if you ever see ways of tracking things and getting that objective data, our mission is literally this medicine. It's amazing. It's nobody doesn't need it, right? Like every home,
100%. Yeah.
right, should have this, and from children to the 100-year-old folks. It's like everybody can leverage this for their health, and that's kind of our mission is really to uh, get the information, educate the educators, educate the physicians, and then my vision in 5 years for Red Eye is to literally have like red light therapy, whether it be a Red Vibe device or some other, in every home,
Yeah.
and having it part of like you got toothbrushes, right?
Yeah.
You're gonna have a red light device.
I think that's brilliant. I really do. Like you said, I
Ashu,
think everyone can benefit from this for sure.
Ashu, any last words as we wrap up? I mean, any advice you have for other physicians like yourself who haven't yet started incorporating photobiomodulation, specifically red light therapy, into their practices? The way you have.
Yeah, yeah. So I think if you truly are in the world of orthobiologics and regenerative medicine, I think light therapy is a critical component. I think we're going to learn more about this as time goes on. But Dr. Parita, Joe Parita, Maybe we can link some of his studies, but he's published several articles on the benefits of light therapy, on cellular biology. And I really think that if you're not incorporating light therapy in your practice, you're really doing a disservice to your clients. Um, it's something very easy to start doing. You can even buy a unit for the office. They're very inexpensive, and I'll give you an example. So one application we've got the Red Vibe 300 in our practice. We had a woman come in. She saw me for her normal visit, but she was having a really bad migraine. I said, "Hey, listen. Why don't you go into our quiet room? We'll bring the Red Vibe in there. 20 minutes, just or my pre and post procedure suite. We'll put the Red Vibe in there. Give you 20 minutes. Just relax. Close your eyes." 20 minutes later, her migraine was profoundly better, and she's like, "Normally it lasts hours, but this really cut it down." And that's something simple that anyone can put in their office. Put it in a
Wow.
room. They're not going to take up your time. You literally put them in a chair, hit the button, let them close their eyes and relax. Let them take a 15-minute nap. Have the medical assistant check in on them, and then see how they do. But it's super easy, super simple. Start with that, and once you have that experience, you're going to be like, "Oh my gosh, we need to share this with all our clients as a potential therapeutic option. No side effects, right? And it's easy. Yeah. There's no taste to it. You just push the button and sit. Yeah.
That's awesome. Well,
One thing I want, Jay, one thing before we go, I mean, just for everybody that's uh, going to listen to this, there are, a lot of docs doing regenerative medicine out there. There are not a ton of them that do it super well or do it at an extremely high level. And, for those that really, and especially in spine, I mean, you can't, there's a lot of docs doing like knee injections and maybe even shoulders, and you can kind of get away with some things in those settings. But with the spine, you need a highly skilled technician that knows what they're doing, and that's where even though he had to experience all the standard medical stuff to get there, the training that Ashu got doing that traditional pain management, it's invaluable. Like that, those skills that he has to put a needle and a device in a medicine in a specific place, it translates so beautifully to put in stem cells, regenerative medicine. And so I would, advocate, and I've been sending folks from all over as I transition into Red Vive and teaching. I've been sending as many folks as I can to Ashu there. And so if anybody out there is listening to this and needs, the highest level of care, especially for spine, and does all the joints as well, but uh, you need to go to Arizona. I mean, and it's worth the travel and the trip, and folks are visiting from all over the place. So I just want to give him,
Thanks, Rahul.
kudos for what he's doing and support his practice, as much as we can. And if people want to know how to get to you, actually, what's the easiest way? Is it a call? Visit the website? Can you give us your
Yeah,
information?
for sure. So I'm on social media, Dr. Ashu Goyle, so DRASHU Goyle. So Instagram is probably our biggest platform. And then our website, www.ispwscottsdale.com. And then our office phone number, 480-660-8823. So those are probably the best ways to get a hold of us. You can reach me directly through Instagram or through our website, and then the office through that phone number I just provided. But Rahul, thank you for that very generous compliment there. But I am blessed. I'm fortunate that I got to train at Cleveland Clinic. Shout out to Dr. Nagy McHale, to Leo Caparel, to Michael Staten Hicks, to Nilesh Patel. Some of the most brilliant minds in pain medicine. Like that year I was there has created a foundation of excellence, precision, and accuracy that I carry with me to this day. And no, very, very fortunate. Yeah, but like you said, So you mentioned that there are people who kind of do these procedures but don't specialize in them to a very high degree. I call those dabblers. There are people who dabble in this field, and then there's people who specialize in this field. And I always recommend seeing a specialist for the best outcome and for safety. Yeah.
Thank you
well, thank you again.
thank you for
Yeah.
being here.
Thank you both, guys.
Yeah.
Appreciate it. Yeah, this is great.